In this video, I'm going to be talking about the staging of carcinoma cervix, and I'll be showing a mnemonic on how to remember the staging, and I'm going to be talking about the WHO staging of carcinoma cervix. So just to brief you, stage 1 is the carcinoma is strictly confined to the cervix. In stage 2, it extends beyond the cervix, but it does not involve the pelvic wall or the lower third of the vagina, and the extension to the endometrium is ignored. In stage 3, the tumor extends to the lateral pelvic wall or involves the lower third of the vagina and causes hydronephrosis or non-functioning kidney. And in stage 4, the tumor spreads to the pelvic organs or has distant metastasis. Now, the mnemonic is Mike, Prime Minister, VIP, and BBM. And so I kind of think of all these letters in one way. I say, I think of mics are used by prime ministers and very important people to broadcast their BBM message. And I'm going to be showing how this mnemonic works exactly. Basically, when you are staging the cervix, carcinoma of the cervix, it is divided into stage 1A and 1B. So MIC is for micro-invasion and C is for clinically visible lesions. So stage 1A is micro-invasive carcinoma and stage 1B is clinically visible lesions. So it kind of makes like a MIC or a mic. Similarly, stage 2 has two parts, 2A and 2B. 2A is without parametrial invasion and 2B is with parametrial invasion. So the Prime Minister kind of helps me remember that I am supposed to write about parametrial invasion. Stage 3 is also divided into stage 3A and stage 3B. And in stage 3A, the carcinoma involves the lower one third of the vagina, so VI, and in stage 3B, the tumor extends to the pelvic wall or involves the kidney. So that helps me remember from VIP, vagina, and the pelvic wall. And then you have to think of the kidney again. So this is how the mnemonic kind of ties in together. And the last part of the mnemonic was the BBM message. So A is for bladder and bowel involvement, and stage 4B is distant metastasis, so BBM. So that's how the mnemonic makes it easier to classify each of 1, 2, 3, and 4 into A and B. So again, the mnemonic is mics are used by prime ministers and very important people to broadcast their BBM messages. And well, in stage 1A is and 1B is also divided into various 1A1 and 1A2, and then there is 1B1 and 1B2. So that's a lot to remember, but well, 1A is basically micro-invasive carcinoma with stromal invasion not exceeding 5 millimeters and lateral spread not spreading more than 7 millimeters. So how I remember this is stromal has an S and S looks like a 5. So stromal invasion not more than 5 millimeters and lateral spread, and when you flip L it kind of looks like a 7, and that's 7 millimeters. A is stromal invasion less than 3 millimeters and lateral invasion or horizontal invasion less than 7 millimeters. And 1B is stromal invasion between 3 to 5 millimeters and lateral invasion less than 7 millimeters. And for 1B, the clinically visible lesions The clinically visible lesions 4 or less than 4 centimeter in size is 1B1, and greater than 4 centimeter in size is 1B2. And the way I remember this is visible is like a V, and 4 also kind of looks like a V, an inverted V. So that's how I remember, and that's all. Hope that helped, and stay awesome.